President.
The senator from New Hampshire.
Madam President, I come to the floor today to join my colleagues because I share their very real concerns about the impact of the Zika virus on families in New Hampshire, also not a tropical state, the impact on people across the country here in the United States, and also on people around the world. You know, as has been pointed out, we've seen reports from regions with active mosquito-borne transmission of the virus, places like Brazil, where they're about to host the Olympics, and people will be traveling there from all over the United States, from all over the world. We've seen those stories of women who have had children with severe birth defects, with microcephaly, as a result of their exposure and contracting of the virus during pregnancy. And we've also seen impact on adults. The connection that seems to be there, and I think we're still waiting on definitive research, but the connection between the Guillain-Barré syndrome and the Zika virus is also very real. And while fortunately in America, in most cases, that can be treated, the reality is in a lot of places around the world, and for some people, it causes severe paralysis and sometimes even death. So this is not just something that affects pregnant women, but there are also concerns about who else might be affected by this virus. And as we've heard from North Dakota, as we've heard from other states, as mosquito season arrives in this country, we can expect additional Zika cases transmitted often by mosquitoes from tropical areas that people contract when they are traveling. But we know that this mosquito is coming to America. In New Hampshire, where neither of the two known mosquito vectors currently live, we've already had 3 cases of Zika, with about 150 possible cases that are still being tested. Now, 2 of these cases were acquired as the result of traveling to Zika-impacted regions, but the 3rd was contracted because of sexual transmission of the disease from a partner who had been traveling. And, you know, last week I chaired a roundtable on Zika in Concord, New Hampshire, in our capital, and we had representatives who are looking at what might happen with the virus and are planning for an outbreak, which we hope we can avoid. So we had doctors from the state, we had the state epidemiologist, we had the director of the state lab, we had people who are working on mosquito control, and they talked about how over the last several months they've been getting more and more questions about Zika, particularly from women who are planning to have children in the near future, and for pregnant women and their families, or women and their partners who are beginning to think about starting a family. The threat of Zika, as Senator Heitkamp pointed out, is very real. We had one of the doctors and obstetricians at that roundtable who reported that many of her female patients are canceling vacations that they had planned, and that some of her patients whose husbands are in the military, who are stationed in Zika-infected countries, are concerned about how to protect themselves and what they need to do when they return. We heard from folks at our New Hampshire Department of Health and Human Services who talked about the importance of increased access to family planning and contraceptives, and the Zika outbreak impact on the need for those services. It gives us a new lens on the importance of making sure that women and families have access to this health care. We need to make sure that all women at risk or diagnosed with Zika have access to comprehensive, patient-centered contraceptives and preconception counseling. We also heard from the folks involved with mosquito control. What they told us is that there are 2 mosquitoes who can spread the Zika virus that we know of at this time. One of those is a mosquito who is only in the tropics, who we're never going to see in northern New Hampshire and in northern New England. But the second mosquito we've already found in Connecticut and Massachusetts. And the mosquito control folks said that unlike the usual spraying for mosquitoes in wetland areas and swampy areas in New Hampshire, that this is a mosquito who, as Secretary Burwell has described it, can breed in as little as a cap full of water, cap, C-A-P, full of water. They are mosquitoes who bite people 4 times in order to get a meal, so they spread very fast. And what we heard from the mosquito control folks who were at this meeting was that they're encouraging people to look at places in their yards where water might collect in small spaces, in wheelbarrows, in paint cans, in places that we wouldn't normally think about mosquitoes growing. They also encourage people to think about protecting themselves. When you're going out, about covering up, wearing long sleeves, wearing slacks, wearing socks, when you're outside at a time when mosquitoes might be around. The other concerning thing about the Zika mosquito is that it also is active during the day. It's not like most of the mosquitoes that we see in New Hampshire, which are active at night. This is a mosquito who's also active during the day. So we need to be taking action now. I listened to the head of the state lab in New Hampshire talking about the challenge of getting results from the lab for people who had been tested for Zika. And he said, you know, sometimes because we have to send out to labs that we don't have the capacity in New Hampshire to do the analysis that's required. We're still looking for a test that can definitively determine if somebody has had Zika in the past. He said something as small as the ability to ferry the samples and the results back and forth is one of the things that we need so we can get answers so we know how to act. The folks who are trying to get information out to the public talked about the need to have support so that they could get information out both to the medical community and to individuals about the importance of what individuals need to do to take action. And they said very directly to me, as I said, you know, I appreciate that this is something that we need to work with you on in Washington. They said, you know, we don't have the resources to respond to this in the way that we need to in New Hampshire. And for those people who would say, don't worry, you know, you're exaggerating, this is never going to come to New Hampshire. Well, that's what they told us about the West Nile virus, and that's what they told us about Triple E. And we've had deaths in New Hampshire in recent years from both of those viruses. So I think we need to act on this. I know that there's been an agreement in the Appropriations Committee among the appropriators on both sides of the aisle. It's been a bipartisan agreement to help get a supplemental funding bill to the floor to address this, because in New Hampshire, what I heard is that we need help. We need you in Washington to help us. And if we're concerned about the cost of this, just think about what our inaction will do. What if we have an outbreak and we have people we have thousands of women, as they do in Brazil, who have been infected and who've had babies with microcephaly? What are the health care costs to people who might have been infected by the Zika virus, with Guillain-Barré syndrome, with other birth defects as the result of being affected during pregnancy? So this is a bill that we can't afford to wait on. We need to address this. If folks are not willing to do it because it's the right thing to do, they ought to be willing to do it because it's the cost-effective thing to do. So, Madam President, I hope we can come together. I know people on both sides of the aisle here are concerned about this. We need to come together. We need to address this. It is a pending public health emergency, and we've got to respond. So.